Hello. Thank you so much for joining me. My name is Melissa Devine. I'm talking with you today on behalf of the Area Agency on Aging 1B and MAP. Today I'm going to discuss all things Medicare during the Medicare 101 presentation with you. Before we get started, I wanted to let you know that at the end of today's presentation, you will have the opportunity to complete a satisfaction survey. The information that you provide will help us deliver the best possible services to people with Medicare and our communities. Thank you for your participation. I'll give you instructions for completing the survey after my presentation is over. And of course, you can ask questions about the survey then. Today we will cover who MAP is, what we do at MAP, and Medicare. What is it? Who can enroll? How to enroll? The parts of Medicare, and more. So let's get started with mapping. MAP is comprised of counselors who can help you understand your Medicare health plans, compare and enroll you in Medicare Advantage coverage, compare and enroll you in Medicare prescription drug coverage, can help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs like the Low-Income Subsidy Extra Help Program and Medicaid. Our services are confidential and unbiased. Our counselors are not affiliated with insurance companies and are not licensed insurance agents. So we're not looking to sell you insurance. Now let's take a look at Medicare. What is Medicare? Well, it's health insurance for three groups of people: those 65 and older, those under 65 with disabilities, and those of any age with end-stage renal disease or ESRD. It is administered through the Center for Medicare and Medicaid Services, or CMS, but the enrollment takes place through Social Security for most and the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions. It does not typically cover dental, hearing, or vision care except under special circumstances. It does not cover long-term custodial care, and there are limits on certain care items such as physical therapy, durable medical equipment. And it does not cover over-the-counter medications. But Medicare does work with private insurance companies to provide Part D prescription drug coverage, supplemental or Medigap plans to help fill the gaps in the original Medicare cost sharing, and Advantage plans to combine the parts of original Medicare, A, B, and D, and some dental, vision, and hearing into one plan. Now, if someone is already receiving Social Security benefits, for example, let's say they're receiving early retirement, then they're automatically enrolled into Medicare Part A and B without any additional application. They'll receive their initial enrollment period package, which includes their Medicare card and other information, about 3 months before they turn 65, or 3 months before the 25th month of disability benefits. Coverage will begin on the 25th month of disability benefits for those that are disabled. Now, if you are not medically enrolled into Medicare, let's say you're still working, you'll want to sign up for Medicare. You might even want to sign up for Part A just because it's premium free and you're eligible for it. But if you want to do so, you want to contact Social Security 3 months before you turn 65. And if you worked for the railroad, you'll want to contact the Railroad Retirement Board to sign up. While Medicare is administered by CMS, Social Security is responsible for enrolling most people into Medicare, and the Railroad Retirement Board, again, is responsible for enrolling railroad retirees into Medicare. But if you want to enroll with Social Security, you can visit their local office, you can call their 800 number, or even do the enrollment online at ssa.gov. You can also call your local Railroad Retirement Board office or their 800 number located on the slide. Now, this is a look at the original Medicare ID card. It is red, white, and blue and is used when a beneficiary gets their health care. The Medicare card shows the Medicare coverage, Part A for hospital, Part B for medical, and the date that the coverage starts. The Medicare ID card also shows the Medicare claim number. That's that unique combination of numbers and letters. And if you choose another Medicare health plan, your plan may give you a card to use instead of this card. But at any point in time, if you decide that you don't want Medicare Part B, you'll want to follow the directions on the back of the card and return it. We can talk more about why you might want to delay your enrollment into Part B a little later. The Medicare has four parts. Part A is hospital insurance, Part B is medical insurance, and Part C is Medicare Advantage plans. Those are the HMOs, PPOs, and they're the all-in-one plan. They roll your Part A, your Part B, and your Part D coverage into one. Part D is the Medicare prescription drug coverage. Now, when you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There's two main ways to getting it. First would be original Medicare. This includes your Part A hospital insurance and Part B medical insurance. And if you want drug coverage, you can join a separate Medicare Part D drug plan. And to help pay your out-of-pocket costs in original Medicare, like your 20% coinsurance, you can also shop for and buy a supplemental plan or a Medigap policy. These can be used with any doctor or hospital that takes Medicare anywhere in the US. Now, the second option is Medicare Advantage. That's also known as Part C. These are the all-in-one alternative to original Medicare. These bundle plans include Part A, Part B, and Part D coverage, and they may have some lower out-of-pocket costs than original Medicare. But in many cases, you will have to use their doctors that are in the plan's network. But most of the plans do offer extra benefits that original Medicare doesn't cover, like dental, vision, hearing, and more. Let's look a little closer at original Medicare. Original Medicare is Part A, hospital insurance, which is going to pay for medically necessary services as an inpatient hospital setting. So, semi private room, meals, general nursing, and other hospital services or supplies, all including inpatient psychiatric care. You also got coverage for skilled nursing facility care, which is not custodial or long term care when certain conditions are met. There's access to home health care, hospice care, and blood transfusion as inpatients. Now, Medicare Part B, that covers a number of medically necessary services and supplies. Of course, they are services received at the doctor's office in an outpatient setting, but that can include doctor services or outpatient medical and surgical services, home healthcare services, durable medical equipment, and even preventative services like exams, lab tests, screenings, and vaccines, all to help prevent, find, or manage a medical problem. Preventative services may find health problems early when treatments may work best. Now, this chart is just a quick preview of the various costs that one may incur under original Medicare Part A. You can see that within Part A, you have a benefit period deductible. So if you go to the hospital and you're there for the first 60 days, you are responsible for the $1,600 deductible. If you're in longer than 60 days during that benefit period, let's say you're there for 90 days, days 61 to 90, they're a $400 per day copay. And if you need up to 150 days, days 91 to 150 are $800 a day copay. And anything beyond 150 days is completely your cost. Now, I keep saying benefit period, and I do want to make sure that I specify benefit period is a point in time in which you've been as an inpatient in the hospital, hospitalized, and when you've come home from the hospital and have stayed home for 60 days, that ends the benefit period and begins a new one. So if you re-enter the hospital day 61 after having been home, that prompts a new hospitalization Part A benefit period, where if you're in the hospital again, the first 60 days are that $1,600 deductible. Now, we do typically see that there is no additional premium to having Part A for most. However, if you are a person who does not have at least 10 years of employment that has paid into Social Security, then you will have, some that you might have to pay towards a premium. So if you've worked anywhere that you've received 30 to 39 working credits with Social Security, that's going to be a $278 per month premium. And for those who've worked less than 30 working credits with Social Security, the monthly premium for Part A is $506 per month. Again, we typically don't see a premium for most people, so it is not something that most tend to worry about. Now, this chart shows the general coverages for Part B, and every year, Part B does have an annual deductible. This year for 2023, it is $226. But you can see that if you have just original Medicare, once you've met your deductible, your medical expenses at the doctor's office, so if you go for um, a doctor's office sick visit, or you're going for physical therapy or speech therapy, durable medical equipment, things like that, those things are a 20% coinsurance of the approved Medicare amount that you are responsible for after you've met your 226 deductible. So that can be a varying cost, and it can bring some concern to some folks. And so that's typically where we see folks want to go with a Medigap policy to supplement and help pay that 20% coinsurance, or they might go the Medicare Advantage route where they know that they'll have fixed cost sharing. Now, of course, I do want to mention where we see the clinical laboratory services, so blood tests, UAs, and more. Those are considered covered, unlimited, as medically necessary, where you pay nothing for services. Medicare has a very great view on wellness and preventative services, which we will touch base on here in the coming slides. But it's just something I want to make mention of because I do think it's really awesome that you can have health, preventative, and wellness services covered, typically at zero. All right, so what is Part D? Well, technically, Part D is optional. In most cases, there are penalties to not getting it when you're first eligible. But Part D is sometimes really the most complicated part of enrolling into Medicare. It involves a lot of research. You do have to research plans and compare prices and more, but that's where a MAP counselor comes in. Again, our MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. And for those with limited income and resources, you may be able to get a program called the Extra Help Low Income Subsidy Program to help pay for your Medicare drug plans. There are different rules for how to choose a plan at that point, just because you'll have different cost sharing, but that's something we can talk about individually if the circumstance arises. Now, Part D is available for all people with Medicare. You can have just Part A or just Part B or both, but you also need to make sure you live in the plan service area. You cannot live outside of the US. You cannot be incarcerated, and you must actually enroll in the plan by completing an application. They don't automatically enroll you typically into a Part D plan. MAP counselors can help with this, and we can help you fill out the application. We can help you assess the plans and more. Now, the Medicare Part D, again, is Medicare's prescription drug coverage. It is coverage provided through the Medicare prescription drug plans and through Medicare Advantage plans that offer the drug coverage. Part D plans must cover a range of medications in each category: immunosuppressants, antidepressants, antipsychotics, anticonvulsants, antiretrovirals, and antineoplastics. Now, you can join a Medicare prescription drug plan when you first become eligible for Medicare. So, if it's during your initial enrollment period, that's 3 months before you turn 65. the month you turn 65, and 3 months after. You can also enroll in the Medicare Part D plan during the annual coordinated election period, also known as open enrollment. That takes place October 15th through December 7th each year. You can also change your Medicare Part D plans during the special enrollment periods. There's a lot of them. So it's a little bit too lengthy to address in this presentation, but they're covered in the Medicare New Book, which is provided to you guys every year in the fall. But we also can go over the special enrollment periods with you as well and make sure that you have a qualifying one. And if you want to join the plan, you can call them. You can enroll on Medicare's website, or you can call MAP and have us assist you with that as well. So now let's take a look at Medigap. Medigap, or the Medicare Supplemental Insurance Policies, are private health insurance plans that provide coverage for just the policyholder. So they're sold by private insurance companies. They're there to supplement the original Medicare costs, like the deductibles, coinsurance, and copayments. They pay for Medicare covered services that are provided by any doctor, hospital, or provider that accepts Medicare. So that can be throughout the whole entire US. Medigap is going to cover certain things that Medicare doesn't, depending on the Medigap policy, but they do have to follow federal and state laws to protect people with Medicare. Again, this is another topic I could do an entire presentation on. So we'll cover kind of the basics. And of course, if you'd like further information, you're welcome to reach out to us and we're more than happy to help. Now, all Medigap policies are required to provide at least the basic benefits, which include Medicare Part A coinsurance and hospital costs covered up to an additional 365 days after Medicare benefits are used up. And that's going to pertain to those Part A hospitalization costs that I was referring to earlier. They also must cover the Medicare Part B coinsurance or copayments, the first 3 pints of blood if needed for a transfusion, and the Part A hospice care coinsurance or copayments. Now, each Medigap plan covers different additional benefits after that. But one thing to note is that plans C and F are no longer sold to beneficiaries that are new to Medicare on or after January 1st, 2020. This was done so that there could be a little more leveling of the playing field, according to Congress. So the majority of the plans that are available to new to Medicare beneficiaries now are going to cover everything except for the Medicare Part B deductible. Now let's take a look at Medicare Advantage plans, or Part C. Medicare Advantage is also called Part C. They're health plans that are approved by Medicare, run by private insurance companies, and generally are an HMO or a PPO. Medicare does pay amounts for each member's care, and the Advantage plans are another way to get your Medicare coverage. Now, if you do join a Medicare Advantage plan, you will have to use their network of doctors or hospitals. So Medicare Part C works like this. It's still a Medicare plan. It's still within all of Medicare's rights and protections. You still have access to Medicare Part A and B services. The plan may include your prescription drug coverage, and they also are going to include extra benefits like dental, vision, and hearing. And the cost sharing and benefits will be different than original Medicare because Medicare pays a set amount of money to these private insurance companies for their members to have access to the health care. That's why you have a designated copay coinsurance. So the time frames in which you can join a Medicare Advantage plan are pretty similar to Part D. You can join a Medicare Advantage plan when you first become eligible for Medicare, so during that initial enrollment period. And you also can do so during the annual open enrollment period, and then also with special circumstances and special enrollment periods. The one additional timeline that you have access to, though, with Medicare Advantage is the Medicare Advantage open enrollment period. So as long as you are enrolled in a Medicare Advantage plan as of January 1st each year, you can elect to switch your Medicare Advantage plan anytime January 1st through March 31st. You can switch to a different Medicare Advantage plan if you'd like. You can switch back to original Medicare with a Part D plan if you'd like. But in order to use it, you do have to have Medicare Advantage as your Medicare coverage effective January 1 in order to use that period. And of course, if you want to join a Medicare Advantage plan, you can do so by contacting their plan directly through their number, by visiting Medicare's website, or by calling MAP and having a counselor assist you further. Now let's take a look at Medicare wellness and preventative services. Medicare Part B covers preventative services like screening exams, wellness visits, lab tests, and immunizations to help prevent, find, and manage medical problems. Preventative services may find that health problems early can be treated and that treatment will work the best. So you must have Medicare Part B with Medicare to cover these services. But these services are covered no matter what kind of Medicare health plan you have. The rules may vary depending on your cost share if you have a Medicare Advantage plan. But talk to your doctor about what preventative services you may need and how often you may need them to stay healthy. And if you meet the criteria for the coverage based on your age, gender, and medical history. The Medicare New Handbook also lists the common Part B covered services and includes the guidelines for who's covered and how often Medicare will pay for these services as well. With preventative services and the cost, when it's under original Medicare, you pay nothing for most preventative services if you get the services from a doctor or other provider who accepts assignment. Now, for some preventative services, you may pay nothing for the service, but you might have to pay a co-insurance for the office visit when you get the service. That is at the discretion of the doctor's office. Now, if you are in a Medicare Advantage plan or other Medicare plan, and you get Medicare covered preventative services, you may have co-payments. And that's again just because Medicare Advantage plans do have their own cost sharing. They have their own co-pays and co-insurances. Now, for all new to Medicare individuals, you get a welcome to Medicare visit with your doctor. It's a great way to get up to date on important screenings and shots, and of course, to review your medical history. But the welcome to Medicare visit is only offered within the first 12 months of getting Part B. During that exam, the doctor will review the following: medical and social history, height, weight, body mass index, blood pressure, and a simple vision test. They will run potential risk factors for depression. They'll review the functional ability and level of safety, which means an assessment of hearing impairment, ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will get advice to help them prevent disease, improve their health, and stay well. They should also get a brief written plan, like a checklist, letting them know if there's any additional screenings or preventative services that are needed. But at this visit, the doctor also may refer you to additional Medicare covered screenings if the referral is a result of a welcome to Medicare visit. There is no cost if the doctor accepts Medicare assignment, and this is a great benefit that people can take advantage of and oftentimes don't know it's available. Likewise, to the welcome to Medicare visit, after that point, you have access to a yearly wellness visit. So after you've had Part B for longer than 12 months, you can get an annual wellness visit to develop or update a prevention plan just for you. Medicare will cover one annual wellness visit every 12 months. Again, during this visit, doctor will do very similar things to your welcome to Medicare visit. They'll record your blood pressure, height, weight, review potential risk factors for depression, check hearing impairment, the ability to successfully perform daily living activities, fall risk, home safety, all of that. They'll give you advice to help prevent disease, improve your health, and stay well. You'll get your brief written plan, your checklist, letting you know if there's any other screenings or preventative services you need. And you don't need to get the Welcome to Medicare visit prior to getting an annual wellness visit. If you choose to get the Welcome to Medicare visit, will have to wait 12 full months from that first Welcome to Medicare visit to get your annual visit. But again, you'll pay nothing for the exam if the doctor accepts assignment to Medicare. Another great service that often is either not known or underutilized for sure. In addition to that Welcome to Medicare visit and the yearly Medicare visit, Medicare covers several other preventative and wellness services. This chart here shows you some of those wellness and preventative services that are covered by Medicare. The 20% coinsurance would apply to some of the services after the annual Part B deductible is met. And again, for 2023, that annual Part B deductible is $226. But there's coverage for cardiovascular disease screenings. This includes blood tests for cholesterol, lipids, triglyceride levels to help detect conditions that may lead to a heart attack or a stroke, mammograms, colonoscopies, prostate cancer screenings, flu shots, pneumonia shots. And with a pneumonia shot, it's going to cover a single dose vaccine and in addition to a 2-dose series. So talk to your doctor or healthcare provider to see which vaccine that you should get. It covers the bone mass measurement, which is a screening to see if you're at risk for broken bones or any osteo issues. Access to glaucoma testing, so screening your eyes for glaucoma, diabetic screenings, pap tests, pelvic exams, HIV screening, COVID vaccines, COVID treatments, COVID testing, COVID antibody tests. There's even coverage under Medicare Part D for adult vaccines. So starting January 1st, 2023, Part D covered adult vaccines that have been recommended by the Advisory Committee on Immunization Practices, or ACIP, will no longer have any cost sharing to them. So that can include your shingles vaccine. That includes the 2-dose shingles vaccine that is out there. There's going to be no deductible, no cost sharing. That includes your tetanus, diphtheria, whooping cough vaccine, or your Tdap, and more. Now let's take a look at some Medicare assistance programs to help with the cost sharing in Medicare. There are programs available to help people with limited income and resources pay for their Medicare costs. These include Medicaid, Extra Help, Medicare Savings Programs. If you think you may qualify for any of these programs, or if you need help and you're not sure if you qualify, give MAP a call. We can set up a time to do a private appointment with you and let you know what programs you are eligible for. Let's take a look at Medicare fraud and abuse. Now a quick word about Medicare fraud. Medicare fraud is one of the most common schemes that affects Medicare beneficiaries. It can be as simple as Medicare or Medicaid getting billed for services that you never received, or equipment that you never got, or equipment that you returned, or if someone else is using your Medicare or Medicaid card to receive coverage, or if a company uses false information to mislead you into joining their plan, or to be really specific, there's currently third-party health care services out there that are offering to conduct your Welcome to Medicare visit or your yearly wellness visit and send the results to your primary care provider. These companies are using direct mailings and ads to try to get your business. They're approaching you saying that you should get those services with them because it's their specialty, that your doctor doesn't do them or they won't do them. And of course, they're no cost to you. So, your insurance and Medicare will cover it and they'll just take care of it and they'll let your doctor know what happens. Well, first and foremost, you're welcome to Medicare visit and any of your yearly wellness visits afterwards are intended to be facilitated by your doctor. This is intended to facilitate communication and planning between you and your doctor. These companies are looking to be the middleman. They're looking to take the money that they'll receive because this is a covered service under Medicare and run off with those funds and not provide you with the service. That is Medicare fraud. We definitely want to make sure that we are reporting those issues. So if you or someone you know may have experienced Medicare fraud or Medicaid fraud in some capacity or another, or even abuse within that system, let us know. We can help report that and make sure that these scammers aren't able to keep scamming. We're here to help. So if you want to speak with a MAP counselor about your specific situation, just give us a call. We're currently counseling over the phone and Zoom, and of course, in person, we're available. And our service is confidential and unbiased. Again, no question is too trivial, and we deal with the complicated questions as well. And for resources outside of MAP, you do have access to the Medicare U book. They are state specific, so they will show specific plans for Michigan. You will have received a hard copy each fall, but you can access an electronic version all year online. There's also access to Medicare.gov, which is Medicare's plan finder and website. And of course, you can always call 1 800 Medicare. However, for the best resource for your local Medicare information, that's MAP. Our services are free, they're unbiased. Our certified counselors are not sales agents, they're not affiliated with private insurance companies. We go through extensive training to make sure that we are constantly up to speed with the newest provisions that are out there. And we can be your best resource on all questions and concerns Medicare. There's no question that's too small or difficult. And we saved over $2 million for beneficiaries in your area. And this is just a quick word about our funding. This is our funding statement from the State Health Insurance Assistance Programs and the Senior Medicare Patrol. Now, at this time, I'd like to give you the option to complete a satisfaction survey. This survey was developed to be a part of a larger analysis of our national program. I did not create this survey, and I will not see any of your responses. The survey is completely voluntary, and it should take less than 5 minutes to complete. It is also anonymous, so you're not required to include any personal information, such as your name, date of birth, or location. And to participate, you can scan this QR code on the slide right now. And if you provide your email address to me, I am happy to send you a survey link instead. Thank you so much. And of course, let me know if you have any questions. My email is listed on the slide. It is mdevine@aaa1b.org. Thank you so much for joining me again. My name is Melissa Devine. I am one of the site coordinators here in Region 1B with MAP. And my email address, in case you have any questions or if you would like me to follow up with you, my email is mdevine@aaa1b.org. Thank you so much again, and I hope that you can take the time to take our satisfaction survey. You have a great day.